So when the South is in single-digit degrees and we have more snow than we hardly ever see in multiple winters combined, what better medical topic to talk about than hypothermia? Okay, so when we're treating any injuries out in the field or any mild cases of hypothermia, it's important to keep these patients covered so we can retain any body heat that they have. Even if someone just has an isolated injury, everything is going to be made that much worse by any hypothermia or any cold to that patient. It's going to cause all sorts of other issues related to clotting or slowing of metabolism. So we want to make sure we retain body heat for these patients. I'm going to use an emergency blanket. So when we're using these emergency blankets are thin Mylar blankets. The point of these is really just to reflect body heat. So if the patient doesn't have much body heat, it's not going to do anything to warm these patients. But in mild cases of hypothermia, it will retain whatever body temperature that patient already has. So I'm gonna open this up here and demonstrate it. There's no thermal properties necessarily to this. It's just gonna reflect that body heat back in. So if you have dry clothes, if you have blankets, if you have even active warming blankets, you can definitely use those. Get the patient out of the cold if possible. But at a minimum, we can throw one of these blankets on to keep them warm, and this is going to reflect body heat back into their core to help keep them warm. So another thing that we can use are these HotHands. So these are active warming, right? So it's a chemical process that causes these to warm up when they're exposed to air. So if you pull these out, expose them to air, we can use these around the neck. We can use them in the armpits, the groin area, anywhere up near the core. The idea is we want to heat the core. We want to heat those large vessels around the core. They're going to be distributing blood and try to keep that blood supply and that core warm. We're not as worried about the hands. Now, obviously, if they are warm enough, but they just have isolated cold to the hands, we can put this on inside their gloves or inside their boots to help keep toes and fingers warm. But if they're digressing worse into hypothermia, we want to make sure we keep that core warm, keep the focus on the core, and use any active warming we have around the core rather than on the extremities. So quick disclaimer here, I've got our responder bag with our medical equipment in it, but I've added some extra warming blankets and things in here. This bag is not typically set up for hypothermia treatment. We have emergency blankets in there, but I've added some additional things I want to show you today. So first thing we want to do with our patient here is we want to remove any wet clothing. If we have wet clothing on them, they're going to lose body heat faster through that. So remove any wet clothing, and then we're going to cover them up. So try to keep them insulated from the ground if possible, put them on a blanket or something. And then obviously, too, when we put them on a board, we want to make sure we insulate that board so that there is a barrier between them and the board so they don't have direct contact with this cold plastic. Okay, so I'm gonna get our patient moved over to this board. I want to insulate him from the board so that he does not have direct contact with this cold board that we're putting him on to extract him out of the wilderness here. So I'm going to throw this blanket on here. We've removed his wet clothes. We'll put dry clothes on him. We'll put an additional blanket if we have it, but I want to have this barrier here. So I'm gonna go ahead and move him over to the board and get him situated. Okay, now that I've got him moved over, I'm gonna get him covered up here with this blanket that we're using to insulate him. Another point to note is we don't want to rub any of his extremities to try to warm him up. We want to be very careful. We jolt him too much if he's in severe hypothermia, we can cause some cardiac arrhythmias, we can cause some heart problems. If you move his skin too much, he's got decreased circulation, maybe frostbite setting in, we can end up damaging that tissue more. So we do want to be careful there. So I've got him now covered up in this blanket, insulated off this board. I'm going to open up. Got a heating blanket here. So these heating blankets are like the HotHands, where once they're exposed to the air, they will start to heat up with a chemical reaction and it produces heat. This needs to be shaken a couple times to try to get some warmth going, and it'll still take a little bit of time for these actually to be fully activated. Now this is gonna be an active warming. So tuck that in around him. So he's got the blanket for insulation. We've got some active warming. This needs a barrier between it and the skin so it doesn't burn the patient. So now it's on top. And then I'm going to use a emergency blanket here, which is one of these Mylar foil blankets. Open this up. I'm going to use this. This foil is going to help reflect his body heat and the heat from this blanket back on top of him. Okay, so we've got him all packaged up. Make sure you cover his head, wrap some blanket or something around it. This is a Reeve sleeve by North American Rescue. It's great to be able to package a patient quickly. We've got some extra straps we can use. It also has handles on the side. If you have a spine board, stretcher, something else, a sled, you can use a sled. If people are out sledding and you have an injury, put them on a sled and drag them out. So that absolutely works. Make sure they're packaged well though so they don't roll out and you keep injury at a minimum to them. So here's just a few of the items we've shown you today. This is the Ready Heat blanket. These are the survival blankets. We have the HotHands here and then just a regular blanket. So make sure before you go out, you make sure you have the necessities with you, because once you go out there and something happens when you're outside in cold, inclement weather, you can't just turn around, walk back inside to grab what you need. So make sure you think ahead, prepare for the worst, pack some of these things with you. And remember that this blanket and these HotHands also are going to take some time to activate. So you're going to have several minutes to get these warmed up. So just make sure you know what equipment you have with you, plan for the worst, hope for the best, and be prepared. So that is our rundown on hypothermia. Hope you found this video useful. You can check out more of our videos on the 6Echo YouTube channel. And also you can find a lot of our products and information and even some of these videos on our website at 6echosystems.com.